Director of the National Institutes of Health, Dr. Francis Collins. We always appreciate you giving us of your time, Dr. Collins. And you said it will take 2 to 3 weeks until we have all the vital information about the new variant. What, though, have you learned so far?
Well, we're collecting that information as rapidly as we can, and much credit to our colleagues in South Africa who have been totally transparent about this. We only learned about this 1 week ago from one of their sequencers. And so we are quickly trying to figure out in South Africa, is this in fact more contagious than other variants? It does look like it's spreading quite quickly there, but we don't know how that would play out in a country like ours where Delta is already so dominant. Would Omicron be able to compete with Delta? We don't know the answer to that. The big question, of course, for us as scientists is, will the vaccine protection that has worked really well against all previous variants, will it also work against Omicron? And how about the boosters? Will they give you additional protection? That's just going to take a couple of weeks. Basically, we need to do that experiment with a pseudovirus that has all of this swarm of mutations that's present in Omicron and see whether the blood from somebody who's been immunized with the vaccine is capable of neutralizing that virus. That is not something you can do overnight, no matter how hard you try. So people need to kind of hang on here for a couple of weeks, and we'll have more of that information. But meanwhile, we do know that in every other instance, vaccines are your best protection, and boosters, if you already got vaccinated, are a really good idea. So if anybody's listening who's kind of like, oh, I was going to get around to it, sign up for your booster today. Go to vaccines.gov and you can find out the closest place to you that is ready to help you.
And thank you for addressing that crucial question, because people were very concerned about if the current vaccines are working. As you said, need more time on that. We do know that New York City has reinstated its mask advisory, recommending people wear them indoors regardless of vaccination status. Would you recommend mask wearing as well until we know the severity of this variant?
I would recommend that even without knowing about Omicron, because Delta is very much with us. We still have tens of thousands of people in the hospital. We have about 100,000 new cases, 1,000 people dying every day. And we know that virus is highly transmissible. So yes, I wear my mask if I'm indoors with other people. I don't always know whether they're all vaccinated or not. That's just good practice. I know we're all tired of this, but the virus is not tired of us, and it's continuing to exploit those opportunities where we're careless.
No, well put there. But other than the vaccinations and wearing our masks and the mitigation efforts that are in place, is there anything else we should be doing to protect ourselves and our families and others?
Well, again, we ought to get the kids vaccinated. Remember, that got approved all the way down to age 5, and yet the uptake in kids has been not as accelerated as maybe it could be or should be. I know parents are looking closely at this, want to be sure that the benefits are there and the risks are manageable. The data is very compelling. So yes, getting all of those folks also immunized starting now would be a great thing. Kids between 12 and 17, you know, they've had approval for vaccinations for quite a few months, and yet only about half of those adolescents have been immunized. This would be a great moment as we're thinking about the holidays, wanting to stay safe. Just sort of let's catch up here on the things that we didn't get done yet.
All right. We know how busy you are, Dr. Francis. Thank you so much, Dr. Francis Collins, for always your willingness to be with us here on GMA. You take care.
Thanks, Rob, and you too.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.